Previously on Call of Cthulhu.
Francis Sanders and Sarah Hawkins, subjects of Dr. Fuller. Why those two?
That accursed gallery. Those accursed paintings. That accursed Sarah. You should talk to Algernon Drake. He's an antique dealer here on Darkwater.
And now, Call of Cthulhu, Chapter 7.
Dr. Colden, this man's condition is deteriorating.
What says Dr. Fuller? It's his patient, after all.
He's busy with Captain Fitzroy. He specifically asked us not to bother him when that's the case.
Oh, of course. I'll see what I can do. Mr. Blake, can you hear me? I'm Dr. Colden. We'll take care of you.
There's nothing we can do. I tried talking to him. He's catatonic.
Oh, okay, so I'm Dr. Colden. Am I seeing... okay. Not sure I completely understand my situation. Let's see. Regarding the patient...
What can you tell me about him?
He was highly agitated an hour ago. We were about to tie him down when he fell asleep. 10 minutes ago, he curled up into a fetal position. I thought he was waking up, but no.
Yeah, why don't you let me have a look at his medical file?
Show me his file.
That's not possible.
Don't tell me Dr. Fuller has taken this file as well. We need it.
That's why I called you. This man's ailment has been hidden from us.
Come on now. What was he treated for?
An intoxication, I was told. After inhaling chemicals.
Huh. Chemicals. I wonder if it's that green smoke. Okay, so I seem to be more than just Pierce and Colden's body because I seem to have some medical knowledge. Okay, so, all right, what symptoms is he having?
What are his symptoms?
His temperature has been going down, his skin losing its color, his body rigid. I closed his eyes myself. They were glassing over. I didn't want them to dry out, and I couldn't bear to look at the expression on his face.
You did well. Don't worry. Let's stay professional, if you will.
Okay, and where did he come in from?
I don't recognize him. Did he just arrive on the island?
He said he worked on the docks, but not with Captain Fitzroy. I think he works for Ms. Baker.
Who?
You know, the woman at the head of their gang. They call her Cat.
Oh, I see.
Do you have other questions?
Yeah, it seems like Dr. Colden doesn't know Cat. That's enough for now.
That'll do for the time being.
Any idea what this man might be undergoing?
I mean, I'd have to look at him. Okay, yes. Examine the patient. Oh, has he been given any kind of drugs?
Did you inject him with a tranquilizer?
No, Doctor. Not me, not anyone. Our stock is empty, yet again.
Again? But there was enough for the whole island.
More and more people are suffering from insomnia. We can't refuse to help.
Of course.
Any idea what this man might be undergoing?
No, now I'm gonna look at him.
Very well. I'll examine him.
Okay, starting up here at his head.
30-year-old subject. Severe hypothermia. Erythematous papules around the eyes and eardrums. Necrosed palpebral tissue. Lord, this smell.
Okay, so it seems like, yeah, I definitely have medical knowledge beyond that of what Pierce would have, so I guess maybe I'm just seeing through Dr. Colden's eyes. Or maybe I'm seeing into the past or the future. Okay, I'm just going to keep an open mind about that.
Severe malnutrition. Swollen abdomen with traces of petechia. Doesn't seem like an edema. Slight protuberances seem to indicate the presence of a foreign body.
Ew, he's got something inside of his abdomen. That's suboptimal.
His skin shows abnormal loss of color and seems dried out. He's totally dehydrated. His fingertips and toes seem to feature a slight ring under the skin, tender at the touch, slightly sticky.
So, Doctor, an opinion?
I'm not sure I have the necessary knowledge to treat this man.
Don't say that. You're our most worthy doctor after Dr. Fuller.
Some of his symptoms are beyond my comprehension.
What did you find?
Well, he's growing suckers on his fingers. He's turning into an octopus. He's probably undergoing a mutation similar to what happened to Charles Hawkins. Let's see. He has something in his belly. The state of his limbs is worrisome. He's severely dehydrated. I'm going to go with the fact that he has a foreign object in his belly.
Did you examine his abdomen? It would seem there's something inside.
He hasn't eaten in days. Are you certain it's not an edema?
No. Can't you recognize an edema? Pushing with your finger won't leave a trace. And look at these bumps.
It's not like he could be pregnant.
Whatever it is, this man has something inside him that shouldn't be there. We should operate on him at once.
Dr. Fuller said not to worry, that the edema would go away by itself.
You know, I'm not sure Dr. Fuller is telling the truth.
Also, he seems to be possibly having a disagreement with Fitzroy back there. There's definitely some aggressive gesturing happening here. Yeah, the state of his limbs is worrisome.
In spite of the muscle contractions, his arms seem limp.
Yes. They can't have decalcified, not at this rate.
And yet, if there is a bone in this arm, it's softer than that of a newborn baby. What about his cranium?
It's soft at the touch. It does seem like the skull of a baby.
Look at these sticky rings growing at his fingertips. What can be happening?
I'm sure you'll find an explanation. You have to.
Okay, and then he is dry as a bone.
I see signs of hypodermoclysis, but he's still dehydrated. When was his last IV?
He's constantly under perfusion. I've even gone beyond the recommended dose to no avail. And you won't believe me, but when we bathed him earlier...
He seemed to feel better?
Yes. Like he needs an aquarium, not a perfusion. But that doesn't explain his condition.
Okay, so it definitely seems like Pierce has no ability to affect Dr. Colden's consciousness because Pierce, I think, has a good idea of what's going on here.
I almost don't believe it myself, but these symptoms are not those usually associated with the human species.
What do you mean? Don't tell me you believe in extraterrestrials.
No. This poor man is from our world, all right. But his body is undergoing unnatural mutations, and this transformation is killing him. His body simply can't cope.
Where could he have gotten such an infection?
I pray that it's not here.
Dr. Colden, may I know what you're doing to my patient?
What I'm doing? How about what you've done to him?
Let us calm down, my dear Marie. I don't appreciate your tone, nor your insinuations. I've done to him what I do to all my patients, provide him with the best available care.
Your imagination is without limit. It's your homemade drug again, is it not? Those people are not your guinea pigs.
There, there. What have you seen to put you in such a state?
Wow, this guy's condescending as hell. Yeah, I've never seen anything like this.
His limbs? His body temperature? I don't know what experiments you've undertaken, but this is going too far.
Oh, I sense some excitement beneath your indignation. Could it be you wish to join me in my scientific endeavors?
You are a brilliant physician, Dr. Fuller, but this man has the attributes of some kind of animal.
Fascinating. An animal, you say? Could you be more precise? Cephalopod, perhaps?
This amuses you.
Your reaction does. I know your thirst for knowledge, Doctor. It's your innocent worries for this man that have you overreacting.
For this man, and the others whose medical files you've been hiding.
I have to protect my discovery. These people owe me their life, but the world isn't ready yet. It will be, in time.
I will not let you do this.
You disappoint me, Marie, but I still have hope you'll one day share my point of view. In the meantime, take care of your own patients and try not to forget who you're dealing with.
Well, he's
Was that a threat?
intensely unlikable.
What did he mean?
It was a warning. Dr. Fuller is this institution's founder and one of our profession's most influential voices. My word is of no weight against his. If I continue to protest, I will only ruin my reputation and career.
It's scandalous. Can't we do anything? Is there no evidence of his crimes?
Well, I'm gonna have to find these medical files, I think.
Oh, that evidence exists. I'm sure of it. I need to find the missing medical files.
And where would you find those? In his office? What if you get caught?
I'd rather not think about that. I'm counting on your discretion.
Of course, Doctor. You can count on me. I'll keep Mum.
Okay, well, I've got one potential ally here. Alright, so I need to find Fuller's files and Fuller's office. Okay, let's see. Alright, so that's block B. Am I in block A?
No, you're pulling my leg. I'm not joking. I saw the schedule. She's alone in the bathroom again. And she still says nothing to that old witch, Donovan.
Oh, listen to the way you talk, you naughty girl. And the answer is no. You can imagine that she doesn't dare say a thing. That silly goose lets herself be trodden on.
Oh well, at least we won't have to clean for a while.
And just wait and see the next time the water's cut off. It's a real show. Dr. Colden?
They seem a little bit, well, I hate to use the word catty. Okay. See if I can find Fuller's office. Okay, that is the way to the psych ward. Is that going to be where his office is? Or does he have an office?
The answers must be hidden in Fuller's office.
Okay, yeah, upstairs he's got an office. Okay. So...
Everybody says it. She's a witch, an old hag. I didn't make this up. And I'm the one who pays. What a pest. It's so unfair.
Who's talking?
Everybody says it. She's a witch, an old hag. I didn't make this up.
Oh, okay.
And I'm the one who pays. What
Right.
a pest.
This is the
It's so
nurse
unfair.
that they were talking about. Alright, let's see what's going on with her.
Elizabeth? You all right? Why is this room in such a state?
Because, as always, I'm cleaning it by myself. And the water was once again shut off this morning. I had to bother Mrs. Donovan again, giving her a new excuse to belittle me.
Is there some... Why go through her? Hang in there. Right, I'm guessing she has no choice but to go through her because she's her superior, if I'm understanding this dialogue option, so maybe I'll just offer her a little moral support.
Come now. Don't let that witch sap your morale. We're lacking in qualified personnel and she knows it. Her petty punishments won't last forever.
I'm trying, Doctor. I'm trying. It's just that sometimes I imagine she shuts down the water herself, just for the pleasure of harassing me.
Her time is much too precious for these kind of petty games.
Anyway, I've learned my lesson. I'll hold my tongue next time.
Courage, Elizabeth.
Thank you, Doctor.
Well, I'd love to give that Donovan a talking to. No reason to be nasty to the nurses. Okay. Maybe she could be an ally for me. The last time I was here, I had to create a distraction. Seems possible I might need to do so again. Okay, let's see. Administration. What's this? What's this? Oh, this looks like it might be a locker room for the medical staff. Some linens, coats. What's this? Maybe a schedule of some kind. Okay. Maybe just the laundry room. Okay, what's the reference book of medical sciences? Like a dictionary, this work references in alphabetical order all the medical sciences. Okay. Well, I guess while I'm Colden, I can't advance Pierce's skills. What's this room?
Wait a minute.
Oh.
Where do you think you're going?
Is
Dr. Colden.
Mrs. Donovan.
Nobody goes into Dr. Fuller's office. But rest assured, I'll tell him you came by.
Okay, so this is
won't be necessary.
Fuller's
Thank you.
office.
I will tell him, nonetheless.
Oh, yeah, I don't like you. Oh, I don't have any option to talk to
I
her
have
about
little time for
Elizabeth?
you, Doctor. You'll find out that it's not only the doctors who have things to do.
Okay. Secondary objectives: distract Donovan, cut off the water. Okay. So if I cut off the water, then Elizabeth will have to talk to Donovan again. Well, that's an awfully mean thing to do to Elizabeth. Alright, so I have to figure out where the water is and cut it off. Okay. Let's see. I think I came from block A, right? What's this room? Oh, this looks like another entrance to this laundry kind of locker roomy place. Okay. So administration. Pharmacy. Oh, what's this?
The doses prescribed by Fuller are far too high.
Prescription for barbiturates. Ooh, I wonder, the name's rubbed out. I wonder if that's Sarah Hawkins. She had barbiturates in her room. I wonder if that's her prescription.
We're running out of this medicine.
I know, Doctor. We sent the purchase order, though, but Mrs. Donovan refused it.
Once again.
Can't you do anything?
Donovan takes her instructions directly from Dr. Fuller. I'm afraid I can do nothing about it for the moment.
Boy, Donovan's really shaping up to be the villain of this this part of the hospital, isn't she? Empty shelves.
We've been waiting to be restocked for weeks.
What's going to happen in this town when everybody is going a little bit batty from insomnia? Okay, so let's see. Dr. Fuller's office is over there. I came in from this way, so let me go this way. Ooh, boiler room. That's promising.
The door to the boiler room is locked. I have to get the key if I wish to get rid of Donovan.
Okay, so that would seem to indicate that the water is in the boiler room. Okay, here's an external door to Dr. Fuller's office, just out of curiosity.
Let's hope I can go through the administration office.
Okay. I didn't think it was likely to work, but... Surgical ward?
The operating room is never accessible after an operation.
Actually, wouldn't keys be admin, maybe? I didn't see any keys in there, though. I'm just gonna really quick take a quick look around, because I was kind of wandering without much purpose when I realized I had stumbled upon Fuller's office, so... okay, yeah, I don't see any keys in here. Like any drawers to open or anything that might have keys. Okay, so... I just want to make sure I didn't miss that. Alright, let's see. So that room, surgical ward's locked. I don't think I'm likely to find keys in there anyway. What's this room? What is this room? Is it labeled?
This man, Edward Pierce, his file is incomplete. What did Fuller do to him?
Okay, so I'm not looking into the past because I've already been here. Although she seems to kind of not know who I am, which is odd. So I'm still not 100% on what's going on at the moment.
Dr. Colden, we need you at once in Dormitory B.
You do? Where's the key to the boiler room?
Would you know where the key to the boiler room is?
Oh, wait.
Betty didn't put it back in its place? Well, she took it to lock the door.
I'll ask her. Thank you.
But if I may say so, Doctor, I think that the problems of our patients are more urgent than the plumbing.
You can keep your commentary to yourself, actually. What's the situation?
What is the problem?
Mr. Evans seems to be having trouble with his IV.
I'll see to it right away.
And the family of Mrs. Harding is asking to see her medical file.
I'll never understand why it's so hard to see patients' files around here.
Rules are rules. See, with Dr. Fuller, he's in charge. Anyhow, they're still waiting, and I don't think they'll leave until they get what they want.
Understood. Anything else?
As a matter of fact, yes. A man has been brought up from the basement.
Oh. What state is he in now?
You should go see for yourself, Doctor.
Okay, so I've got some patients to attend to. I do see now here's the keys, and the boiler room is missing. Can I have these other keys, though? No. I feel like maybe that would be handy, but... Ah! Huh. Nurse. Personal space. Okay, so... What did she say? Dormitory B? Ah. I'm guessing that's block B. Right? The Hawkins wing. Generous donor and unfailing support. Probably supporting Fuller's research. Okay, let's see. Who is this patient? Oh, straitjacket. This is probably the guy who was brought up from downstairs. Nurse, give me a report.
Dr. Colden, here you are at last. This patient was again brought up to the psychiatric wing. We've been following the treatment you prescribed, but the dysgeusia persists and he's lost a great deal of weight. We haven't been able to move him. The stress makes him hyperallergic.
Sir, I am going to examine you. Do you understand? Inject him with a dose of pentobarbital, intramuscular, so that I can conduct the clinical examination.
Alright, so let's see. I do want to comment on the variety of accents of the nurses here. We've got like a southern, maybe a New Yorkie type thing. It's a very cosmopolitan hospital.
His binds left bloody wounds.
Yeah.
He bit his lips so much, they're still bleeding. White froth, evidently because of such drooling.
So, Doctor, what should we do with this patient?
Well, he was obviously kind of abused downstairs with the bindings too tight. I don't know what I could do. I don't know what purpose I would have in telling her that.
You did good work. The tranquilizer is kicked in. Now you can disinfect and bandage his wounds.
Thank you, Doctor. And as to his weight loss?
I'll prescribe an antifungal treatment for his dysgeusia. In the meantime, feed him intravenously.
It'll be done.
Okay. Okay, who's this? Oh, we've got a chart.
Another insomniac. I should find the cause for such a widespread trouble.
Okay, so this is, I guess, not one of the patients the nurse was telling me about. Okay, anything useful over here? Oh. Okay. Yeah, I was definitely looking for that.
The key to the boiler room. All I have to do is shut off the water and hope Donovan takes the bait.
Alright. So that's good. Who's this? Let's see, I think I'm trying to remember who else I'm supposed to look at. Somebody wanted to see a medical file.
She recently came back from the surgical block. She's stable. Given her file, a nephrectomy would have been inevitable. But Fuller was able to save her kidney.
That's interesting. So it seems like he does do good medical work from time to time. Who's this?
Why did nobody tell me about her admission?
Irene? Let's see. The file describes the state in which Irene Sanders entered the Riverside Institute, as well as the treatments administered to her. Fuller added a handwritten note. He recommends to take her down to the psychiatric wing in order to provide her with the quiet and rest that she needs. Huh. Yeah, fat chance of that. It's not very restful down there. So, Irene. So, yeah, I think this is definitely not the past. This probably happened after I visited her as Pierce.
Mrs. Sanders?
And she's out of it. Okay. Who's this fellow?
He broke his back in an accident down by the docks.
The whaling station. What's wrong with me?
What are you talking about?
Doctor, that you?
Yes, it's Dr. Colden. Tell me what happened.
It's the old whaling station. See?
Tell me what happened.
What did you see there?
Nothing. Nothing at all. The floor was all rotten and I fell straight through.
And that's how you broke your back?
Perhaps. No idea. Passed out.
Huh. Okay. Well, not the first person who had something terrible happen to them and has no memory of exactly what occurred. Reminds me of Bradley. Well, and also myself to some extent. Okay, I think maybe this is the last patient.
Please. My chest.
His perfusion of a semi-physiological solution doesn't seem to work. He's undergoing a ventricular fibrillation. Nurse? Deborah, come and help me, please. His potassium level is too high. Replace it with 2% glucose solution with insulin, calcium, and sodium bicarbonate.
I'll tend to it right away.
Thank you. He's in your hands.
Electrolyte imbalance. Yeah, potassium. I've learned from television that potassium overdose can cause a heart attack. Trying to remember what show I learned that from. Okay. Oh, so I have the key now. So I just need to make my way back to the boiler. I think I've probably seen all the patients I was supposed to. Who's this?
Gentlemen, may I help you?
We're waiting on news regarding our mother, Maureen Harding. She came in with a kidney problem, but we haven't heard anything since.
Oh, I saw her. She is fine. Recovering nicely. Against all odds.
I've tended to her, and I have good news. Her blood analysis is reassuring. Her kidneys are as new.
Are you talking about the same person? This is miraculous.
She's still recovering, but you may speak to her upon her awakening.
Oh, thank you so much, Doctor. We'll wait for her to wake up. We've been here since this morning, so it won't make a difference.
All right, good. Aw, you guys waiting to see their mommy. That's very sweet, gentlemen. Okay, now I might be talking straight out of my butt right now, but I think cephalopods have regenerative capabilities that are pretty remarkable, if memory serves. So I wonder if some of Dr. Holden's research is actually legitimately trying to save people. Where's the boiler room again? It wasn't by there. I lost track of where the boiler room is. Is that it? Yes, boiler room. Okay. Ugh, this place is a mess. Man, pretty much everything on this island needs to be upgraded. Although maybe for 1924 this is like state of the art. Okay, let's give this thing a crank.
I can't shut this with my bare hands. I need a tool.
A tool. Okay, let's see. Tools. Here's some tools. Anything? Actually, these appear to be broken cart parts, maybe. Wheels, handles. So not tools. Okay, where would I find a tool? I did see... Let's see, when I was in that room that had the keys, is that... Where's that? I believe I saw a key for a storage room, maybe? Or am I making that up? Let's see. Storage room, mate. Oh, storage room. Okay. You got any... There's a book. Medicine and Secret Sciences. I hope Pierce gets a chance to come through here. I feel like he'd really increase his medicine knowledge. So, does not appear that I have any tools in here. Okay, let's see. Is there a maintenance room? That would also be a good place for tools. What's this? Oh, that's a bathroom. Well, I should check anyway. Oh! Look at that. Oh, I'm glad I looked. I've been walking around for a really long time trying to find a monkey wrench. Okay, back to the boiler room, which is on the left here, I believe. Okay. All right. I'm sorry, Elizabeth. You're taking one for the team here. Okay.
I feel guilty about Elizabeth, but I need the diversion.
Alright, so that right there is Fuller's office, but I need to go in over here. Okay, let's see. Oh, what's happening with her clothing? That's... I should... Oh, okay. It's fine.
Dr. Colden, might there be a problem with the water?
There might be.
It seems it's been cut off yet again.
I can't take this, Marie. I feel I'm gonna burst.
It's not your fault if we have defective plumbing.
And yet, I'm the one who gets punished because I'm gonna have to square off with that annoying old witch. Courage, Elizabeth. Here we go. And hold your tongue this time.
Oh boy, I feel like such a meanie. Because, you know, I could very reasonably go tell her to turn the water on because I'm a doctor and she's a nurse. Wait. Could I just go walk in there now? I should have just waited till she moved. Okay, it's happening. Got my distraction. Let's see. I'm just gonna...
At last. The missing files must be hidden here.
A little privacy. All right. Files.
The Stendhal syndrome. Of course. This is where Fuller found his diagnosis for Francis Sanders.
A study of the Stendhal syndrome, a particularly rare mental illness. Subjects display mental disorders linked to an exposure to works of art. Yep, that fits. There's more than a work of art, though, I happen to know. Okay, I can't get into actual file cabinet, which is where I might expect to find files, but I guess if he's hidden them, they're not just going to be in the filing cabinets. Scylla.
Something is wrong with these masts. It's some sort of puzzle.
I guess we want them to all face forward. Alright, so that turns the first two. And that turns the back two. Okay, so... and this turns all of them. Alright, so I'm gonna assume that I want all of them to face forward. So the first one's facing forward, so this means... and these two are facing the same way, so this means I want to turn the back mast.
I've unlocked something.
Yes.
Patient files. I was right.
This cylinder was hidden inside Fuller's office. He recorded his thoughts about one of the many psychoanalysis sessions he submitted Sarah Hawkins to. Okay, so... alright, so I'm gonna need a phonograph. Probably shouldn't just sit here and listen to it in his office. Seems conspicuous. Well, the door's closed. I'm gonna just do it.
Conclusions. Session number 17. Patient? Sarah Hawkins. The patient appears to have finally accepted the illusory nature of what she calls the mythos. It goes without saying that these peculiar delusions are the price that comes with her exceptional gifts.
Okay, so that's her file there.
Why does Dr. Fuller write psychological reports about Sarah Hawkins?
At first, I presumed that her blood was the key.
Oh, I wonder if she doesn't know that Sarah was a patient here.
Mrs. Hawkins' abilities.
Abilities. What might her abilities be? What is...
The poor souls downstairs are not Fuller's only subjects.
Okay, so...
Then James came, irate that Charles was keeping secrets from him. I presume that he will try to break into the basement sooner or later.
The basement here, or the
I am prepared.
basement at the Hawkins Manor?
Hawkins, Fitzroy, and Fuller. What is the connection between these three?
It is fortunate that I had the presence of mind to set the morgue in the basement. When all the fuss about the Hawkins incident finally comes to an end, I will dispose of her belongings.
Oh dear. What's that?
They must remain hidden in plain sight.
That's pretty sinister.
Why is Ethan on medication?
Oh, is that Ethan's? How... why is it in here, though? Okay, let's see. What else am I looking at? Oh, the shoe.
Of course. Sarah Hawkins is the connection.
I guess she means the connection between Fitzroy, Charles, and Dr. Fuller. Okay. So...
I must go back to the basement.
So I guess what's happening right now is Dr. Fuller is kind of, or not Dr. Fuller, Dr. Colden is getting up to speed with many of the things that Pierce has discovered. I'm still not sure what's going on with Pierce. I read the book, saw some strange visions, and I'm now I guess I'm just seeing what Dr. Colden is experiencing, perhaps. Okay, so I gotta go downstairs. Alright, I guess. Well. This is pretty terrifying. Okay. Okay, that's what is this? Oh, this is, okay, that looks like the elevator for patients on wheels who can't go down the stairs. Okay. This is a lot of stairs. This like, what are we, 3 stories underground? Oh, there's blood. There's blood. Okay. Dr. Colden, I hope you're up for this. Let's see. More broken cart parts. Alright, I've got a door here, a door there. Can I get in here? No. So it looks like I'm gonna have to use one of these other doors. Looks like I'm gonna have to use that one door over there. Maybe, I don't know what this room is. Maybe there's a key in there or something. Oh, or Dr. Fuller. Great.
Ah, now that's the Marie that I know. I knew I could count on your scientific curiosity. It's time to show you what you were so eager to discover.
Whoa, no. Oh, no. Next time on Call of Cthulhu.